The broadcast is now starting. All attendees are in listen-only mode.
Hello, dear colleagues. I'm glad to see you all at our webinar. Let us wait for a few minutes for others to join us. Thank you. Hello, dear colleagues. My name is Julia, and I'm digital marketing expert at Cobalt Engine. I'm glad to meet you all at our webinar. And today we will expand on the issues on, first of all, how to engage more loyal customers through the digital content and gain a deep understanding of the benefits of interactive content. We'll also explore true digital content strategy thanks to only one tool. You are free to ask me all your questions during the webinar, so please write them down to the chat. Thank you. To begin with, technical progress makes everyone not only to catch up with the multiplicity of possibilities to widespread information through various gadgets and applications for them, but even to surpass ourselves. Pharmaceutical companies, first of all, and med representatives are not the exception to this rule. They obviously need to increase their effectiveness in marketing, taking into account the customer's needs and using the different digital healthcare innovations. What is more here, if traditional advertising is just drawing out your money without producing any noticeable results, it is essential to try something totally different. And the solution here is e-detailing. E-detailing in big pharma, for example, becomes popular all over European and Asia. We agree that not only knowing but also realizing what the client wants is the thing that really matters. For rather a long period of time, psychologists have been investigating the possibility to attract a client and also cause his strong desire to receive immediately the product that is advertised. Finally, the way to understand clients have been found. E-detailing is a good way out of misunderstanding between medical representatives and physicians on the both sides. Med representatives can finally move from the push to a pull type of communication. There is no more need to be a kind of a chatterbox in front of the physician, making him to absorb all the information you're ready to share with him, especially taking into consideration the fact that he indeed will not comprehend it anyway. More than half of your effort then will be wasted in vain. You can now get the comprehensive insight of what the physician is ready to hear about your product according to what he told you last time. E-detailing analyzes his answers and supplies you with the most up-to-date information about his real needs, thus helping you to tailor your marketing strategy to your customers' demands. Also, there is a good way to keep safe all the analytics received without any losses and giving all the information about the physician preferences and even prompting the med rep a definite scenario of communication at every visit. What is the goal of e-detailing? The answer is to give the pharmaceutical companies an objective view of what their products are on the physician's opinion. This will allow them to develop their marketing strategy in a convenient for physicians and also for the pharmacist and patients way. Dear colleagues, if you have any questions, please write them down to the chat. I will be glad to answer all of them. So, pharmaceutical companies sometimes realize they just waste money on the product advertisement because they do not clearly see the final point. They are aware of what they sell, but they rarely understand how to reach an individual approach in sales. So, e-detailing identifies first of all what the physician wants to hear and see, and it analyzes the received data and gives a ready-made solution of presenting something in an attractive for a client way. So developers all over the world work on creating new e-detailing presentation because it empowers being creative, it allows to insert many innovative features and still being flexible about all the needs of the clients, making the tools absolutely universal and receiving a feedback that will further show an objective attitude of physician toward the pharmaceutical product. So, what will you choose to be successful in selling your pharma products? Which way you will follow for becoming the leader on the world market? Don't waste your resources. E-detailing is an ideal solution for those questions. Nowadays, e-detailing is the use of digital mobile platforms such as tablets and phones to express marketing messages and drag information to providers into simply adaptive format. So e-detailing has become a significant part of marketing mix in the pharma industry with high budgets for its development. Apart from this, the benefit of e-detailing lies in its ability to quantify the levels of engagement. So while this may not be able to give the necessary qualitative insight, it still remains one of the most accurate measures to understand the direction of the provider is taking when considering the brand of the cure presented to him. So during last 2 years, quality of medical service has grown with the evolution of digital branch. Patient-centric engagement philosophy has started taking root in strategic plans and will continue to influence major marketing decisions. As it is shown on the screen, and you can trace it, that according to the recent survey, doctors spend on average 7.5 minutes for e-detailing, so versus the 2 minutes for just a sales rep call. And this provision of the data, which includes all the links to health service guidelines, to benchmarks, and to some prescribing combination and comparison, not only eases and makes the simple information gathering for doctors, but it also paves the way for reps to undertake a full selling visit. That is, that time can be spent addressing specific competitive product or prescribing issues rather than simply just providing a kind of a full stack of information on just new product. So the increased contact time for virtual visits also saves marketing expenses, as physicians can access more information faster and companies can use e-detailing to better control detailing content. The same content developed for use on the web can also be used to train new sales representatives. Lastly, with the physician practice information that pharma companies can capture electronically through e-detailing use, firms can identify potential high prescribers for field representatives to target later, thus creating compelling and also really memorable presentation enables sales reps to deliver engaging content to healthcare professionals. As for example, best-in-class performers know that an effective e-detailing strategy works to keep customers interested first of all and engaged. Dear colleagues, don't forget to write down your question and I will answer them immediately. Thank you. So top performers understand the real opportunity behind maximizing the customer experience and the engagement by using the tablet. Committing to innovation determines how well companies can master the use of technology. Actually, they understand that it's time to innovate and go beyond conventions and ultimately transition to what the popular all over the world is telling. Being a successful medical representative today is not an easy task because, on the one hand, the success of your visit directly affects the success of the entire company, and on the other hand, during the visits, medical representatives are facing lots of difficulties and barriers to make his work really effective. And I'm not talking now about our common communication and psychological barriers. I mean more complex aspects, that is, possibility to be heard and ability to effectively persuade the listener and make your visit perform brilliantly. And in this case, the human factor indeed plays a crucial role. So, fairly often a medical representative can simply forget to bring the required materials for the presentation, or some important results of the previous meeting could just slip away from his mind. So what we are doing in this case, meeting will be probably similar to the previous one, and it will surely irritate the doctor. Most likely that your success will be in doubt then. Besides, there is no need to re-emphasize the problem of the permanent lack of time. Squeezing your speech into 5 minutes makes no use at all. And this is just the top of the iceberg. Actually, there are more challenges that MedRep is constantly facing. But don't despair here. Digital technologies are the solution to all of these listed problems. So, digital media channels today are widely used as well as at work, at home, in communication with friends, and it is becoming increasingly popular to use digital technologies in big pharma. Gone are the days when a MedRep had to spend hours waiting for a doctor, preparing for visits all night long, dragged behind a pile of paper of materials. E-detailing perfectly replaced all those routine actions. Imagine that all important information for the visit and smart analytics goes in a small tablet. Tempting, isn't it? From now on, with e-detailing, pharma companies can establish their brand awareness, what is really important here, increase familiarity and facilitate the sales using multi-channel marketing that usually does not require a face-to-face contact. E-detailing has appeared as an awesome solution for pharmaceutical sales directors, which are usually eager to build an efficient dialogue with the physicians, likewise for market access managers who are aimed at enhancing the impact of their value communication strategies. As our experience shows that the main challenge while working on the new product is modernization and simplification of business processes in pharmaceutical companies, as well as facilitating interaction and sales force efficiency through the introduction of smart e-detailing processes. So assessing this situation and taking into consideration market forecast, it can be concluded that customers need a unique product that will not only facilitate but also speed up the process of development of e-detailing and make it absolutely accessible to everyone. This is the key point. So life is too short to waste it on the routine. So being an accomplished medical representative becomes much easier with the new inputs into digital technologies. Make e-detailing your first goal on the road to success and you'll be out to win. Now, having a profound understanding of what e-detailing is and how it can be used, I would like to tell you in details how exactly pharma companies can develop interactive presentation and become a completely independent provider of the presentation, which will help to receive the best customer experience. Coupled engine is the single standard in e-detailing production for the growing agencies to start development from scratch. The engine is a perfect solution to the content development for any CLM system. For you to understand better what I am talking about, I will demonstrate it as an example. So imagine that you have limited budget for digital content development and several local offices for distributing it to them, which use various CLM systems. Undoubtedly, you will be looking for a digital or a creative agency that will develop e-detailing faster but at lower cost, and if possible, without any additional investments on its adaptation. So if you are pressed for time and budget, having a strong need for the universal content, Cobalt Engine is absolute way out here. This framework suggests, first of all, a unified approach to HTML5 presentation development for both agencies and pharmaceutical companies, thus standardizing the processes of content production and also minimizing the investments on e-detailing adaptation to any CLM system. So with Cobalt, you can create presentation 4 times less resources consuming. I will point out the key features of the Cobalt, and first of all, I would like to mention that localization process have never been so simple. So you don't need to go deep into the code, just open the file and change the text. Now localization is more about translation rather than coding, and it really saves developers time. You can forget about routine work because all the processes in Cobalt are fully automated, which speed up your presentation development. Also, Cobalt allows you to create presentation for any CLM tool. It has cross-platform usage, both iOS and Android, and it makes the framework even more attractive and applicable. Dear colleagues, I'm still waiting for your questions. Please write them down to the chat. So Cobalt includes more than 40 modules which can be customized and to companies' needs. So you can create presentations using a bundle of interactive modules such as pop-up, pie chart, color floor, sliders, graphs, and all these modules will capture live feedback and track analytics. To get more information about modules, you can visit our official website of Cobalt Engine, and where you will find the detailed description of each module you will have with Cobalt. The content management with Cobalt becomes absolutely flexible. You can choose whether to develop the presentation on Cobalt from scratch or transfer existing e-detailing into Cobalt format. Thus, you'll be able to edit, to localize, and to distribute the presentation faster and more often than before. So what is the final result the company can gain using Cobalt? Now I would like to demonstrate you an example of presentation which was made on Cobalt. Like this presentation presented just the brand brightly and in very colorful manner, I guess. And it will also help you to understand and clarify the attitude of the client toward your product, and will collect qualitative analytics, and also will convey all the necessary information at right time. So I'm just connecting my iPad to the computer in order to show you this presentation. Okay, here you can see the screen of my iPad. And this presentation, which was made on purpose for pharmaceutical market, just to show the main modules which are used in Cobalt. Here you can see the icon of the medicine, and by tapping on it, you can see the menu with the chapters. And on tapping on this icon, you can see the first module, which is called Slider, which collects analytics, which then will be forwarded to the CLM tool. Then by pressing on home button, I come back to the main menu and the chapter and this slide, which is called patient story. On tapping on this icon, I can see the module graphs, which are vertical. Then a module which is called carousel with some additional information here. And a touch module to emphasize on some kind of information. Here on the top, we have a module which is called thumbnails to navigate easily between the slides. Here on the bottom, we have a paint tool in order to point out some information. And here is the possibility to attach a PDF file with more detailed information. On the left, you can see reference module. And again, coming back to home page. Tapping on the middle icon, we can see the module which is called drag and drop, which shows how the cure affects the illness. And here are also design references. The last icon, which is this one, and it forwards us to the automatic animation module. That is all with the presentation, with just a simple one, because here the only limit is your imagination. So, summing it all up, we advise you to visit our official website on the link indicated on your screens. Also, please sign up our groups in social networks and watch the announcement for the next webinars. Our actual next webinar will take place on next Friday, that is 26th of June, and the topic is digital content evolution. Are you ready to keep up? Well, this is all for now, so thank you all for your attention. We'll be glad to take all your questions, which you can send us to the email that is also shown on your screen. Have a nice day. Bye bye.